Hi, everyone. My name is Dr. Meg Stone Heberlin. I'm a psychologist in the Division of Developmental and Behavioral Pediatrics at Cincinnati Children's Hospital. Today, I'm going to have a short presentation on learning to tolerate wearing masks in public, specifically for individuals with developmental disabilities. All right, so why? Why are we being asked to wear masks? The CDC is recommending wearing cloth masks in the community to slow the spread of the coronavirus. This is especially important now that we know that some individuals may be asymptomatic. And what that means is that people might be infected with the coronavirus but might not be showing symptoms. Because they're not showing symptoms, they might be going into the community or going to work, and they're not realizing that they may be accidentally spreading the virus. So by wearing a mask, you're protecting yourself, but you're protecting other people as well. We're going to be wearing masks in public settings where social distancing is difficult. Places like grocery stores, pharmacies, even medical settings or doctor's offices may ask people to continue to wear masks in the community as we move forward, at least for a short period of time. Surgical masks or N95 masks are not recommended for people in the community. We do need to be saving those resources for our healthcare providers that need them. Cloth masks are safe and should be used instead. So who should be wearing masks? Right now, the CDC is recommending all children and adults who are in public settings where social distancing will be difficult. Children under age 2 should not be wearing masks. Anyone who has trouble breathing should not be wearing a mask. And anyone who is incapacitated or is not able to take a mask off on their own should also not be wearing a mask. Those people should be staying home. How do we wear masks? Well, your mask should fit snugly but comfortably around your face. It should be secured with either ties or ear loops. It should include multiple layers of fabric, but it should allow for breathing without restriction. Before you put a mask on, make sure to wash your hands. As you put your mask on, try to be careful to not touch your eyes, your nose, and your mouth. When you get back home from an outing and you're taking your mask off, wash your hands first. And then again, be cautious to not touch your eyes, your nose, and your mouth. Your cloth mask should be washed routinely, and you can use your washing machine. If you're going out frequently and using that mask, you should also be washing it frequently as well. So I have a cloth mask here that I'll show you. My wonderful grandmother made this for me. It's got 2 ear loops. It's double layered, which I know is hard to see, but it does fit snugly around my face. I'll put this on for you. But it's comfortable, I can breathe, you can still hear me talk. So it's not a terribly unpleasant experience, although I know it is a bit strange. All right, so individuals with developmental disabilities. This is going to be a hard task for many individuals with sensory processing concerns. This is a hard task for everyone, but we want to think about this as learning a new skill. When we learn a new skill, we have to take certain small steps in order to learn that skill. Think about riding a bike. First you had somebody push you, then you had training wheels, and then you were off to a good start riding your bike. And wearing a mask is going to be kind of similar to that. So when we think about individuals with developmental disabilities specifically, we want to put some other supports in place first. So think about using a social story or a social narrative with a lot of pictures about why to use a mask and how to use a mask. We have created one of those. It's available on our Facebook page. You can also get it by emailing us. All of that information is available at the end of this presentation. Think about other visual supports as well. We know that visual supports are especially helpful for individuals with developmental disabilities. On your screen here, we put together a first then board. So we would be teaching this person to first wear their face mask and then receive some type of reinforcement or favorite activity for doing so. So in this case, first wear your face mask and then you can have tablet time. We also want to model wearing masks for people that might be scared or uncomfortable to do so. So if you have a child or an adolescent or working with an adult with a developmental disability, model wearing that mask. Caregivers can model, other siblings can model that, but showing your loved one that this is not as scary as it might look is a great first step in teaching them to wear the mask on their own. Other supports we can put in place as we're learning to tolerate masks. So using a visual timer. If you're not familiar with visual timers, they're a concrete way to show time passing. So time is actually a pretty abstract concept. Using a visual timer can really help with that. So if you look at the bottom of your screen, there's a few examples there. The visual timer and the visual countdown timer are both free apps that you can download to your smartphone or your tablet. The time timer in the middle is an actual timer that you can purchase offline. So we're going to use a visual timer to show the child how long they need to practice wearing that mask. We're also going to use reinforcement and praise to really encourage that new skill. We're going to break this into really small steps. We're going to practice at home first, and we're going to practice over multiple days or even weeks if needed. So breaking this into really small steps, the first thing that we might need to practice is just touching this to our face. We know that many kiddos and adolescents don't like their ears, their head, their face touched, and that is a challenge, especially when we need to be wearing masks. So we're going to break this into really small, tolerable steps to practice. So we might first just practice touching it to our face or even touching an ear loop to our ear for 10 seconds or less. Okay, and then once there's low distress with that step, after we've practiced maybe several times, you might practice actually putting the mask on and keeping it on for 10 seconds, using that visual timer to show how much time is left before they can take it off and take a break. Once there's low distress with 10 seconds, we might bump to 30, then we might bump to a minute or 2 minutes, but this needs to be done in really small steps with success at each step before we move on. Okay, so we've practiced this for multiple days or even weeks now, and we're gonna go out into the community. We're gonna try this with wearing a mask. So what should we do? Set the expectation. It should be really clear what your child or adolescent needs to expect when they go out, especially with the expectation of wearing the mask. So either a verbal explanation of, we're gonna go to the grocery store. Once we go to the grocery store, we need to put on our mask. The mask needs to stay on the whole time we're there. As soon as we get in the car, we'll all take off our masks and take a break, and then we can have tablet time or a favorite activity or snack. So we're adding in that reinforcer there as well. So some specific examples here, just off the top of my head. So you might try using like your cell phone as a reinforcer during a grocery store trip. So in this example, Johnny gets to watch the cell phone video while his mask is on. If his mask comes off, then the video would need to be paused. We give a reminder, Johnny, please put your mask back on, then video. He puts his mask back on, the video resumes. So he's getting that reinforcer, that fun activity while he sits in the cart with his mask on. A different example, at the grocery store, Sarah gets a sticker. Every 2 minutes she keeps her mask on, and those stickers add up to some special activity or reinforcer when she gets home. We also want to be doing a lot of praise and positive attention for keeping that mask on. So even if you're not offering stickers or tablet time or a favorite snack or some other reinforcer while the mask is on, it's a really good idea to just pay a lot of attention to the fact that your child is complying and keeping that mask on. They're keeping themselves safe and they're keeping other people safe too, and we're really proud of them. All right, that's a really quick rundown of some steps we can take to build some tolerance to masks. This is not going to be easy for everyone. This is very strange for everyone. This is temporary though, and I think that's really important to remind your family members that this is temporary. We're just doing the best we can to keep ourselves and other people safe. I want to let you know that developmental and behavioral psychology at Cincinnati Children's is offering telehealth consults to new and existing patients in Ohio, Kentucky, and Indiana. This is not a crisis stabilization line, but it is an opportunity for families to have video chats with psychologists about other concerns like wearing masks, like tantrums at home, like staying on task during homebound schooling. So please use that opportunity if that would be helpful for you. You can call 513-636-8107. If you need other resources or have other questions, please email us at ddbpfamilysupport@cchmc.org, and we'll get you in contact with a family support associate that can help you as well. Lastly, we have a wearing a mask social story that we've created and might be helpful for some folks. You can find that on our Kelly O'Leary Center Facebook page and the USAID Facebook page as well, or you can email that DDBP Family Support email address on your screen and we'll send you a copy. Thanks so much. Have a great day.